So first I gather my equipment. It's all gathered. I'm gonna wash my hands, and then I would pull the curtain for privacy, and then I'm gonna be like, sir or ma'am, whatever, can I get your name and date of birth? They would say it. I would check the wristband, and then I'm gonna explain the procedure. Today I'm gonna be changing your wound dressing, just like taking the bandage off and putting a new fresh one on. Safety survey. Make sure the bed is in the lowest locked position. All eyes within reach. Patient would have non-skid shoes on. I would check the provider order on the EMR, and then review institutionalized policies. And then I'm gonna teach the patient about the procedure. So I'm gonna take off your bandage and just like take all that stuff out, clean out your wound, and then put like a new bandage on, and just clean everything out. Okay. So I'm gonna ask you your pain. So, sir, can you rate your pain on a scale of 0 to 10? I'd give my response. And if it was like 8 or above, I would contact the doctor and get some pain meds. I would assist the patient in like getting in a comfortable position. So maybe like slightly elevating the head of the bed, but not too much. Gonna wash my hands again and put on some gloves. So I'm going to loosen the edges of the tape carefully. I'm going to pull it up. And then I put this in a biohazard bin. I'm gonna inspect these dressings for any kind of drainage they might have, and I'd be looking out for purulent drainage, which is like yellow, pussy. I'm gonna assess the wound.
Do my safety checks, and now I'm gonna remove and discard my gloves.
And area, so there's a little inflammation, not seeing any granulations or anything, and it's there's no organs, so that's good. It's not eviscerated. And then I would remove my soiled gloves, just put this there, and then wash my hands. Put on some fresh gloves. I'm gonna use some saline gauze. Then I'm gonna pull up corners, a little bit force, and then I'm gonna clean from top to bottom.
And depending on how much drainage there is,
One more. Another one for the edges.
Loose side
then I'm cleaning inside, like inside the wound and the outside of the wound.
And I would grab my paper tape.
This one's gonna get the outside. Right now I'd check if there's any meds ordered, and then if there were, I would use the 3 safety checks and the 11 rights. So like I would check the, like as I'm getting the med, as I'm preparing the med, and then at the bedside, and then the 11 rights of medication administration. So right patient, right route, right time, right drug, right dose, right documentation, right to refuse, right response, right reason, right education, and right assessment data. So then I would remove these gloves
All around the corners.
and then wash my hands. Put on some clean gloves. I'm gonna fold up one of these gauze pads
Remove my gloves.
in half
Wash my
and
hands.
then pack it inside of the wound. Oh, I missed this, but before I did this, I would have measured the length from the belly button down,
To initial.
the width, and then the depth.
Put the date and time.
Abdominal pad.
And then I'm gonna assess the patient.
With the blue side up.
And then I would document.
I'm gonna tape on. Window pane.
I don't see why not. I don't wanna do that.
Tape here. And then I'm gonna remove my gloves. And then on this piece of tape, I'm gonna write the day and time. I changed it, so 20, and then my initials. I would probably have gloves on for this, but it's okay. And then I would come back later and ask the patient about their pain and like redress the wound and then document that again. And that's it.